These are the top headlines from our newsroom today. His Majesty the Sultan exchanges Ramadan greetings with Arab and Islamic leaders. Hospital beds under stress as COVID-19 cases surge in the Sultanate. Easing of COVID-19 measures possible during Ramadan. Agreement signed to train 3,000 Omani job seekers. UK completes COVID-19 vaccination, target of people over 50 ahead of schedule. India became 60th country to authorize Russian COVID-19 vaccine Sputnik V. COVID-19 pandemic, long way from over, warned WHO chief. 109-year-old Kagawa becomes world's oldest Olympic torchbearer. These were the top headlines for the day. Let's see how the weather condition looks like in the Sultanate in our weather update.
This is Mayfel Shukeli with today's weather update. And right now, I'm inside the TFM studio in Al Khair. Before we move on to weather, here is our fact for the day. If the weather forecast gives a 50% chance of precipitation, that could mean that there is a 100% chance of rain and 50% chance of the forecast area. That is our fact for the day. Now let's take a look at how the weather will be like in the Sultanate. According to Oman Meteorology and Civil Aviation Authorities, there will be mainly clear skies in the Sultanate with chances of isolated rain and cloud development over Al Hajar Mountains. And there's also chances of late night to early morning, low-level clouds or fog patches over the parts of South Al-Sharqiyya, Al-Wusta and Dhafar. And now let's take a look at how the weather will be like in all the governorates. Muscat will be sunny, temperatures between 38 to 28 degrees Celsius. Musandam will be partly cloudy, temperatures between 37 to 27 degrees Celsius. North Al-Batana will be partly cloudy, temperatures between 33 to 25 degrees Celsius. Al-Buraimi will be partly cloudy, temperatures between 38 to 28 degrees Celsius. Al-Dhahira will be partly cloudy, temperatures between 39 to 26 degrees Celsius. Al-Dakhiliya will be partly cloudy, temperatures between 38 to 26 degrees Celsius. North Al-Sharqiyya will be partly cloudy, temperatures between 37 to 23 degrees Celsius. South Al-Sharqiyya will be partly cloudy, temperatures between 39 to 27 degrees Celsius. Al-Wusta will be sunny, temperatures between 38 to 22 degrees Celsius. And Dhafar will also be sunny, temperatures between 28 to 18 degrees Celsius.
Welcome back to TTV. You're watching Midday Update. Now, before we get into the details of the local stories for the day, let's go straight to the COVID-19 updates. The Ministry of Health in the Sultanate has announced the registration of 9 death cases due to coronavirus in Oman today. This has taken the total death toll in the Sultanate to 1,798. The Ministry of Health officials have also extended their deepest condolences to the families of the deceased. In addition to that, the Ministry of Health has also registered 1,335 new coronavirus cases in Oman today. The total cases in the country have now touched 174,364, including 154,771 recoveries and 1,798 deaths. According to Ministry of Health, in the past 24 hours, 785 recoveries were also reported. The ministry has urged everyone to adhere to social distancing instructions issued by the Supreme Committee and the Ministry of Health. And now from a local desk. His Majesty Sultan Haitham bin Tariq has exchanged cables of greetings on the Advent month of Holy Ramadan with the Arab and Islamic leaders of the brotherly and friendly countries. In his cables, His Majesty the Sultan expressed his sincere greetings along with his best wishes of good health, happiness, and a long life to them and their country's people for their progress, prosperity, and welfare. In their cables, the leaders expressed their sincere greetings along with their best wishes of good health, happiness, and a long life to His Majesty the Sultan to achieve all aspirations of progress, prosperity, and welfare for the Omani people under His Majesty's wise leadership. They prayed to the Almighty Allah for the return of this occasion on His Majesty, the Omani people, and Arab and Muslim nations with blessings, bounties, and prosperity. The main committee for the moon sighting of the month of Ramadan announced yesterday in a statement that the crescent moon for the month of Ramadan was not being sighted, and therefore Wednesday, April 14th will be the first day of the month of Ramadan. With a rising number of hospitalizations and ICU admissions due to the COVID-19, just 14 beds are available in intensive care units across the country. As 751 patients were taken to hospitals, the number of admissions in the ICUs rose to 234. The highest figure during the pandemic so far was reached on April 11, 2021. 96% of all beds in intensive care are now occupied by COVID-19 patients. The total number of cases in the country stands at 173,029 as of yesterday, inclusive of 153,986 recoveries and 1,789 deaths. Although more beds in intensive care are required to accommodate future admissions, Dr. Faryal Al-Lawati, the head of the Infectious Diseases Unit at the Royal Hospital, said it is not as easy as it seems to expand ICUs owing to a number of reasons. She said, vacant beds in hospitals cannot be occupied by just COVID-19 patients, and if we do increase the number of beds for them by converting existing beds to one designed for intensive care, it means we have to reduce other health services provided in exchange for more coronavirus admissions, explained Al-Lawati, who is also a senior infectious diseases consultant at the hospital. She continued saying that if the rise in the number of COVID cases does continue, the healthcare sector in the hospitals will be forced to halt some of their health services provided to ordinary people. Many of these are essential functions. We only have a limited number of staff in hospitals in Oman. It is difficult to provide staff to cover this increase at present. 3 shifts per ICU patient are needed every day to provide care for them, which means each patient requires 3 nurses per shift to take care of him on a daily basis. When the numbers of COVID cases increase, other departments of the health sector have to release their medical teams and transfer them to the coronavirus wards or the ICU so that they can cover the shortage of staff we face in treating these patients, admitted Al-Lawati. She also said that each hospital has a certain number of beds and assigned medical staff that has not changed since their inception. The increase in case of infection in the country and the subsequent spike in hospital admissions has also forced all hospitals to postpone both essential and non-essential surgical procedures required by many in the country. Earlier, hospitals in other governorates used to also send their staff to Muscat, which had the highest numbers of COVID cases in the country. But now that other regions are also experiencing increased infection rates, hospitals there can no longer send their staff to supplement medical teams in the capital. Now, measures adopted to prevent the spread of COVID-19 during the holy month of Ramadan can be eased if the infection rate in the country decreases, the Minister of Information has said. The decisions that were taken for the blessed month of Ramadan can be reviewed, said Dr. Abdullah bin Nasir al-Harasi. He said that if the cases decrease, procedures relating to activities and movement will be facilitated, and if the situation worsens and the cases increase, stricter decisions could be taken. The minister added that for this reason, everyone must adhere to the precautionary measures and reduce gathering. The situation may seem illogical, but the number of infections continue to increase despite closure of businesses. But if we look at this from another angle, the nature of the virus, its mutated strains, and the existence of a new wave would have doubled our numbers without this closure, he went on to say. The minister was speaking during a press conference of the Supreme Committee, which was attended by the heads of various news organizations, including Oman News Agency, Sultanate of Oman TV, newspapers, and other media representatives. During the meeting, Dr. Ahmed bin Mohammed Al Saidi, the Minister of Health, said the virus strains in Oman had mutated more than once and that the country was paying serious attention to its vaccine drive. He said that failure to comply with precautionary measures such as gatherings are among the reasons for the increase in the number of virus cases, new strains. The lack of vaccinations has nothing to do with the financial problem. His Majesty Sultan Haytham bin Tariq is an essential supporter of providing vaccines. The Ministry of Labour and the Authority for Small and Medium Enterprises Development, commonly known as ASMAD, today have signed a cooperation agreement to provide training programs for 3,000 job seekers. The move comes to support SMEs to qualify national cadres capable of competing for job opportunities in various sectors in the labour market. The agreement aimed to offer a package of incentives for SMEs to attract job seekers, train and qualify them to achieve their envisaged goals. The agreement was signed by Syed Saleh Musallam Al-Busaidi, Human Resources Development Under Secretary, and Halima Rashid Al-Zirai, Chairperson of ASMAD. This was all from our local desk for today. It's time for us to take a quick commercial break, but stay tuned as we have more updates coming your way from our international desk.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
It's about time we kicked COVID-19 out of our lives. Join us on TTV Outline every Monday and let us learn how to fight COVID together. Welcome back to TTV. You're watching Midday Update. And now from International Desk. The United Kingdom has completed the vaccination of people aged over 50 ahead of schedule, administering first shots of coronavirus vaccines to millions of people, Downing Street said on Monday. UK Prime Minister Boris Johnson, in a statement, said, "We have now passed another hugely significant milestone in our vaccine program by offering jabs to everyone in the 9 highest risk groups. That means more than 32 million people have been given the precious protection vaccines provide against COVID-19. I want to thank everyone involved in the vaccine rollout, which has already saved many thousands of lives. We will now move forward with completing essential second doses and making progress towards our target of offering all adults a vaccine by the end of July," he said. Now, according to the UK government, all adults over 50, the clinically vulnerable, and health and social care workers have now been offered coronavirus vaccine shots. The target was reached ahead of schedule, with the government having pledged to offer a first dose to priority cohorts 1 to 9 by April 15th, Downing Street said, adding that nearly 40 million vaccines have now been given in total, with adults under 50 expected to begin to be invited in the coming days. Those in their late 40s are expected to be next in line to be invited for coronavirus vaccine shots as the UK moves into the next phase of its mass vaccination campaign, according to Sputnik. Over 7 million second doses have now been given, with a record 475,230 given on Saturday, and we remain on track to offer a first vaccine to all adults by July 31st, Downing Street said. The mass vaccination campaign started in the UK in December of last year. The UK has now confirmed a total of over 4.3 million coronavirus cases, and the country's COVID-19 death toll stands at more than 127,000, according to Johns Hopkins University, as reported by Sputnik. India has become the 60th country to authorize the use of the Russian COVID-19 Sputnik V vaccine against coronavirus, and the vaccine is now approved in countries with a total population of 3 billion, or 40% of the world's population, the Russian Direct Investment Fund, commonly known as RDIF, said on Monday. The Russian Direct Investment Fund announces that Drug Controller General of India has approved the use of the Russian Sputnik V vaccine against coronavirus in the country. India has become the 60th country to approve Sputnik V, the RDIF said in a statement. The vaccine has been registered in India under the emergency use authorization procedure based on results of clinical trials in Russia, as well as positive data of additional phase 3 local clinical trials in India conducted in partnership with Dr. Reddy's laboratories, according to the company. Sputnik V ranks second among coronavirus vaccines globally in terms of the number of approvals issued by the government regulators. There have been now 7 consecutive weeks of increasing COVID-19 cases and 4 weeks of increasing deaths globally, Tedros, Director General of the World Health Organization, said on Monday, adding that the coronavirus pandemic is long from over. In January and February, the world saw 6 consecutive weeks of declining cases. We have now seen 7 consecutive weeks of increasing cases and 4 weeks of increasing deaths. Last week was the 4th highest number of cases in a single week so far, Tedros said during the briefing. The WHO chief noted that several countries in Asia and the Middle East have seen large increase in cases. This is despite the fact that more than 780 million doses of vaccine have now been administered globally, he said. He again emphasized the public health measures of wearing masks, maintaining social distancing, testing, contact tracing, tracking, and isolation. While citing many countries around the world have shown that the virus can be stopped and contained with proven public health measures and strong systems that respond rapidly and consistently, Tedros said that the global body does not warrant endless lockdowns. He said many of those countries have gained control over COVID-19 and their people are now able to enjoy sporting events, concerts, restaurants, and seeing their family and friends safely. WHO does not want endless lockdowns. The countries that have done best have taken a tailored, measured, agile, and evidence-based combination of measures. We too want to see societies and economies reopening and travel and trade resuming. But right now, intensive care units in many countries are overflowing and people are dying, and it is totally avoidable, the chief added. Tedros stated that the coronavirus pandemic is a long way from over. However, he said that the world has many reasons for optimism. Once again, it's time for us to take a quick commercial break, but stay tuned for more updates from our sports desk.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
It's about time we kicked COVID-19 out of our lives. Join us on TTV Outline every Monday and let us learn how to fight COVID together. Welcome back to TTV. You're watching Midday Update. And now from a sports desk. Shigeko Kagawa, a 109-year-old woman, has become the oldest Olympic torchbearer after she took part in the Tokyo Olympic torch relay in Nara Prefecture on Monday. Kagawa, who was born in 1911, took the record from Aida Mendes of Brazil, who walked with the Rio Olympic torch in Macapá, Brazil, when she was 107 years old in June 2016. Kagawa is the second centenarian to attend the Olympic torch relay since it started on March 25th. Shitsui Hakoishi, a 104-year-old barber, carried the flame in the rain on March 28, 2021 in Tochigi Prefecture. But the world record is expected to fall next month when Kane Tanaka, the world's oldest living citizen, is set to carry the Olympic torch. Tanaka, 117, is recognized by the Guinness Book of Records as the oldest person in the world and was already Japan's senior citizen. She is due to carry the flame when it passes in Fukuoka Prefecture on May 12th. With this news, we have come to the end of the episode for today, but stay tuned as we'll be back again tomorrow with more news and latest updates your way. Keep watching TTV.
You've just heard the live feed from the TTV studios on TFM 95.4. Let's talk.